Lisa Marie finally opened the door the 5th time she tried. It was about midnight. Her twins and her 15-year-old were in her rusted green Honda. She drove to the yellow brick house that she had found with a United Way hand on it, the local shelter, knocked on the door. She was safe for 6 months. They got her into safe housing at a local co-op. She thought it would be great. Her twins were freaked out of their minds. Her teenage daughter didn't leave the room for 6 months. She was finally invited by some of the residents to a basement where they were writing a proposal for $8,000 to United Way. They thought, after years of agencies trying, that they were going to be able to help young people get to school ready, do better in their EQAO scores, help high school dropout rates, and stop the amount of times that the cops were coming into the neighborhood. And this group of 4 women not only applied, got the funding from United Way, but they started a local childcare co-op. They got Lisa Marie's daughter out of her bedroom to start an after-school program with 10, 20, 40 kids. They started community gardens. And one summer afternoon, Lisa Marie got up to receive the Canadian Co-op Federation Award for the best co-op in Canada. And her first words were, "We are who we are with and where we are with them." It's good to be with you here at the YW, a United Way partner, on these hallowed lands from the Indigenous community, because you really are our partners. But this story actually goes back a lot longer. A priest, a rabbi, 2 ministers, and a woman advocate, this is not a joke, I'm not, got together in this bar. There was all kinds of problems in this community. Their jobs were drying up, marriages were breaking up, people were fighting, people were drinking. And they said, we've got to find a way to solve some of these community issues. And in 1887 in Denver, these 5 came up with the first United Way ever. And they went around with envelopes and their hands out, raising money. And since then, United Way has been following that damn thermometer. And then, about 100 years after that first meeting in the bar, a United Way in the US said, that's it. It's about community. And every United Way across the world started digging back into community. Here in Toronto and York region, the largest United Way in the world, we turned outward. And we started talking to residents, community groups about issues, income gap, early learning, mental health, lack of social housing. You know all of the maladies. And what became very clear, community is the solution. And we are not going to fundraise, social service, or charity our way out of this stuff. If that's all you remember about me today, I hope you remember that. We are who we are with and where we are with them. Community is the answer. And we are not going to fundraise, social service, or charity our way out of these social issues. And so we in United Way shifted from the thermometer to the community. And at the core of that shift has been our research capacity, our commitment to community research in all of its complexity, some reports, some town hall discussions, and merging that together to shape our work together as we go forward. Good old community work. No drive-through accelerated solution, no single bullet, no one agency, no program that we're going to scale, no one population that we're going to focus on. Community. For slow, lasting, measurable change. And these 6 pillars, research first, and then investment, evaluation, strategy, partnerships, and advocacy. And research has always helped us identify what the pressures were across this region. Some of you will know our Poverty by Postal Code report, which transformed how we do business and where we invest in the community. Research allows us to build partnerships and uprisings of care with others. When we released our precarious employment report, PEPSO, it was a partnership with McMaster, Labour, Ministry of Labour, the Toronto Star, and most recently with KPMG, where we are using precarity as a tool to engage with corporate partners and shift their HR policies. Research forms the basis of our public policy work, whether it's the Vulnerable Workers Act that was passed unanimously at Queen's Park, or our recent work around Community Benefits Agreement, where in partnership with Metrolinx and the province, we are ensuring that every Metrolinx project, from the Eglinton Crosstown right across to all of their builds, will ensure 10% of the workers come from that local community. That is policy and impact on the ground. And research has identified how we invest in the community. When you think about Poverty by Postal Code, not only did it shape our Building Strong Neighbourhood strategy with the city, but it also led to priority neighbourhoods, 7 hubs that have been built, and the complete re-energizing of our agency funding. A few thoughts for you around how we measure these results. Like so many of you, we measure the effectiveness of our investments in a number of ways. And behind the scenes, we fight like hell on what is an outcome, an output, an input. We measure the number of people served by our agencies, the number of visits to the hubs, which equals now about 1.5 million people who have met at the hub, met other people, participated in the hub strategy. We monitor the organizational health of a fragile, expansive network of agencies that exist across the region. But because we are a learning organization, we have also taken our research into community, whether it's at our Action for Neighbourhood Change partnerships with residents across the region, or a series of meeting house conversations right across this region, church halls, basements, where we have brought residents together to talk about the key issues. In all of them, what's become clear and what resonates today is that if we really want to change the continuum for supports and move the needle for children, we have got to move the needle for children, families, neighborhoods. And we cannot do that without looking at community in its entirety. We also know that our research, public policy agenda, and government relations are our single best strategy to move government on large scale, like in the Community Benefits Agreement, to make change. So a quick example on how research has influenced our work on the ground. The Poverty by Postal Code report released in 2004 examined the increase between 1981 and 2001 in the number of high poverty neighborhoods across Toronto and how that concentration of poverty was impacting vulnerable groups. Not only were we able to work with the then government of Ontario on their poverty reduction strategy, but early on, we completely shifted our funding from the inner core of Toronto, where the bulk of our agencies were, into what is today a map of our funding across the region, which is a massive U right across the suburbs. Interestingly, about a decade later, we are now having to re-examine if we need to put more services back into the core of Toronto as it intensifies and changes. But thus the value of our partnership and our continued commitment. We came together with the City of Toronto to look at the Building Strong Neighbourhood strategy, and as I mentioned earlier, built 7 hubs with an additional hub underway. This report then led to Vertical Poverty in 2011, which examined the growing concentration of poverty in many of our high-rise towers. And in 2012, we launched the Tower Neighbourhood Renewal Initiative, which brings together stakeholders to revitalize tower communities. The City of Toronto has since reformed zoning bylaws to promote neighbourhood vibrancy and allow for programming so that there can be economic vitality in those neighborhoods. The last piece I want to talk to you about in terms of our research, a cumulative of poverty by postal code to the opportunity equation, which positions Toronto as the income disparity capital of Canada, right through to our recent work around youth unemployment. All of that and our work on the ground in neighborhoods is transforming how we invest with our agencies. Currently, over $5 million of our investment goes directly to children. What I'd like to speak to you more about is the total, more holistic investment. About 2 weeks ago, we announced a record $87 million commitment to programs and agencies across the region. It's a record of investment, about $1 million more than last year. What's interesting about this, based on all of our research, is we are deepening our work in poverty and geography. Number one, we have invested in 62 anchor agency partners. They will work with us for 5 years in an up and down strategy. Frontline support on the ground, community development in their neighborhood, and public policy and advocacy and research as well. Because we know that we're not going to social service and charity our way out of this. And we need this inner core of 62 partners across this region, deep in poverty work, to turn the needle on some of these pressing social issues. In addition, we are, for the first time in a decade, opening funding for new programming so that our current agencies and new partners can apply under 9 program streams, from early years through to mental health, through to homelessness. For us to continue to meet the needs of this growing region, we have to maintain work with our current partners, but open it up for new charities and supporters as well. You would know in all of your work that for us to continue to make an impact and turn the needle, not only do we have to have strong research, but we have to ensure that that investment is following the data. That summer day, at that podium, receiving the Co-op Award, Lisa Marie said, "When I first got here, nobody came out of their houses. Today, 85% of our community is connected. And I feel like I belong. Belong. It's the most powerful word. I'm involved in this community. I've got a part-time job. My twins are in JK, ready to learn. My daughter graduated from high school and is going to university on a scholarship. We are who we are with and where we are with them, and community remains the answer. Thanks.